Gardens today for, can't hardly believe it, but it's our 6th session of the Powerful Women, Powerful Decisions Luncheon. My name is Stacy Dreyer, and I'm the Business Development Officer here at First National Bank, and I'd like to welcome you this morning. So again, thanks again for coming out. Today we aren't specifically talking about finances, but we're talking about a very important topic, and that is healthcare reform. So obviously we've had a very good response. People are very interested in this, and we have an outstanding panel that will be joining us today. We are going to hear about all the fun things that are going on at Ryman Gardens today here just very briefly. Lisa Ordler is with us, and she is the Assistant Director, and she's going to tell us about it. Hopefully you guys have heard about the giant gnome that's perching out here, but she's going to briefly tell us about some of the fun things going on this summer at Ryman Gardens.
Thanks, Stacy. Welcome everybody to Ryman Gardens today. We are so thrilled to be hosting this lunch today and this series from First National Bank. So again, we just want to thank you for coming today. And we hope that you'll come back as visitors also with your families. As you know, or hopefully you know, Ryman Gardens actually has a theme year every year. And we do that for selfish reasons and for other reasons. We hope that people will want to come back every year. We don't want to hear people saying, we've been there, we've done that, we've seen everything there, because we do change every year. And the other reason we do it, of course, is just for planning purposes. It's easier to plan if you actually have a theme or a reason for planning, as most of you know. This year, our theme is Celebration of Garden Ornamentation. It is such a mouthful, I know, but it's really about garden ornaments and all the fun, silly things that people put in their yards. And we will do our best to make it as tasteful as what we think tasteful is, but really what is taste. So hopefully you'll have fun when you come here this summer. Some of the highlights, of course, Stacy had mentioned the largest concrete gnome in the world. We're saying concrete because we were beat out by Poland. They have a gnome that's 1.5 feet taller than ours that is fiberglass. But ours is better and more beautiful. So you are here and you get to see ours at least if you don't get to Poland anytime soon. We also have a great show called Gnome Sweet Gnome, where we actually ask different organizations in central Iowa to decorate smaller versions of our large gnome. And it's just a great collection. We have a gnome walk map, so you can pick it up in the hallway and walk around and look at those gnomes. It's great for kids and non-kids to look for the gnomes in the gardens. We also have a flamingotorium. We'll have a summer breeze display, which is about wind and capturing wind. We'll have a topiary display. We'll have a fairy garden and a troll garden. So those are all being implemented right now. So you'll have to come back in a couple of weeks to see the displays. But the gnomes are here. So there'll be lots of neat things for you to see also right now. And I'm supposed to keep this short. So again, just welcome. I just want to welcome you and thank you for coming today. And I hope you'll enjoy your visit. Thanks.
Okay, well, we are going to jump right in today because I'm sure a lot of you have a lot of questions to ask about healthcare reform. Like I said, we have just such an outstanding panel of local experts here with us today. So I'm going to go ahead and introduce them, then ask them, each of them to speak for a couple minutes about their point of view on the healthcare reform bill, and then we'll jump into our questions. So first, I'd like to introduce Jolene Randall. Jolene has worked in the health insurance industry for over 20 years as an agent for NAP Tedesco Insurance Agency right here in Ames. She has more than 500 hours of ongoing continuing education on health insurance. She currently serves as the chairman of the Ames Chamber of Commerce Government Affairs Committee, and she has served the past 3 years on the Independent Insurance Agents Legislative Affairs Committee. That's a mouthful, Jolene. And she holds a Bachelor of Science degree from Iowa State University. Mike Tretina is filling in today for Brian Dieter. He had an emergency he had to attend to, but thanks for filling in today, Mike. He is the Vice President and CFO at Mary Greeley Medical Center. He holds an accounting degree from Pennsylvania State University and an MBA from LaSalle University. He is a fellow in the Healthcare Financial Management Association and involved with the American Institute of CPAs, among other professional associations. In the past, he's been involved with the United Way and Families and Professionals for Children with Disabilities, as well as other nonprofit organizations. And then also we have Dr. Michael Kitchell, and he is a neurologist who has been with McFarland Clinic since 1979. He has a Bachelor of Science from Iowa State, and his medical degree is from the University of Iowa College of Medicine. Dr. Kitchell serves as board president at McFarland Clinic, Iowa Medical Society president, 2009 and 2010, the AMA Group Practice Advisory Committee Chair, Iowa Healthcare Collaborative and Physician Consortium for Performance Improvement member. So let's welcome our panel today. So I don't know who is dying to go first. I know you all have a lot to say. So Dr. Kitchell, should we just start with you here? Well, I have a microphone down here, so you just
I'm eating a bit of technical support.
Thanks. I think many of you know that about a year and a half ago I wrote a 13-part series on healthcare reform, knowing that this past year was going to be an important one for our country in trying to solve a lot of the problems of our healthcare system. So in 5 minutes I won't be able to summarize all that. But we'll talk a little bit more about the health law. I keep calling it the health care bill, but it's actually a law, as you know. And obviously some of these impacts are going to take place over the next 4 years or so. 2014 is when most of these will come to pass. But to basically summarize the bill, this mostly offers insurance reform, that is coverage of Americans, and there are going to be 32 million more Americans that will be covered by insurance. That's about 94-95% of this country. And they are going to do it by two major means. One is by expansion of Medicaid for those people that are very low income. And that's going to be about 40% of those additional people covered. And then the additional folks will be about 60% will be covered by the health insurance exchanges, that is private insurance that will be obtained through state-run health insurance exchanges that will hopefully simplify and make it easier to purchase various ranges of insurance products that will be offered by private insurance. So the majority of this is not a public option. It's not a government-run program, but as you know, it's government-funded. And so the Medicaid expansion will be mostly funded by federal dollars coming to help the states. Right now, 2/3 of Iowa's Medicaid funding, which is almost $3 billion. About 2/3 of that funding comes from the federal government. So again, for the health insurance exchanges, for the private insurance, that will be subsidized for people of various incomes up to about 400% of the poverty level. And so that subsidy will be coming again from the federal dollars. And of course people say, well, how are we going to afford all this? Because it's going to be about $1 trillion over 10 years. But I'd like to remind people that during the Bush administration, the Republicans and some of the Democrats actually passed a law called the Part D plan for Medicare. And as you know, that was an expansion of the federal government's role in health care, paying for the drugs for Medicare patients. And you may be surprised to know this, but that will hit $1 trillion sooner than this health care law will hit $1 trillion. And people have told me that this is a really expensive way to cover 32 million Americans. We are actually spending $2.5 trillion per year on health care. Half of that is the government funded, either through tax breaks for insurance or through Medicare and Medicaid. Half of that $2.5 trillion is covered by the government. But this new bill is going to cost, this new law, is going to cost us about $100 billion per year. So if you think we're going to add 32 million Americans for $100 billion per year, that's adding 11%